Hello guys and welcome back to my channel. I'm Dr. Astha here and today we are going to study about acute inflammation. In the previous video we learned the inflammation definition, causes, signs and types of inflammation. And in this video we are going to learn about the components of acute inflammation, that is the vascular events and cellular events. So let's start with the video today. So very first we have the vascular events. Vascular events. Whenever there is an injury or an infection, your body reacts through inflammation, right? So the first thing that happens are at the blood vessel or the vascular level. So vascular events are alteration in the microvasculature. What are microvasculature? Arterioles, capillaries and venules. So alteration in the microvasculature is the earliest response to tissue injury. As I said, in case of any injury or infection, the very first thing that happens are at the blood vessel level. Now we'll understand the vascular events, that is the hemodynamic changes, in a very easy step-by-step method. The very first, what happens is temporary vasoconstriction. Okay, so what is temporary vasoconstriction? Immediately after injury, the blood vessels shrink for a few seconds. Okay, so the question is why they shrink. They shrink to minimize blood loss. Okay, so the very first step is temporary vasoconstriction. The next step we have is vasodilatation. What happens? What is vasodilatation? It is the widening of blood vessels. Okay, it is widening of blood vessels. What happens over here is the small blood vessels, you can say the arterioles, they open up. Okay, they widen up. Now this increases the blood flow and further increases the redness. Remember the sign of inflammation, redness is rubor, and heat, that is calor. Okay, so first temporary vasoconstriction and later we have the vasodilatation. Then we have the increased vascular permeability, which is also known as leakiness. What happens over here is the vessel walls become leaky. That is, the plasma moves out, which causes swelling. Swelling is also called tumor. Now what is plasma? Plasma is fluid plus the proteins like fibrinogen, antibodies, etc. So they move out, which will cause swelling. Then we have the stasis or slowing of blood flow, which is since the fluid leaks out, the blood inside becomes thicker and moves slowly. In the previous step, what happened was increased vascular permeability, that is the leakiness, wherein the plasma moved out, resulting in swelling. So now, since the plasma already moved out, the fluid had been leaked out, the blood inside becomes thicker and it moves slowly, and this allows WBCs, white blood cells, to line up along vessel walls. Then we have the stasis or slowing of blood flow, which is since the fluid leaks out, the blood inside becomes thicker and moves slowly. In the previous step, what happened was increased vascular permeability, that is the leakiness, wherein the plasma moved out, resulting in swelling. So now, since the plasma already moved out, the fluid had been leaked out, the blood inside becomes thicker and it moves slowly, and this allows WBCs, white blood cells, to line up along vessel walls. Okay, and the last step is the leukocyte margination and last step is leukocyte margination and adhesion. So what happens here is WBCs stick to the inner walls of the vessels, and later they move out into the tissue, the WBCs move out into the tissue to fight infection. Okay, so the 5 steps are temporary vasoconstriction, second is the vasodilatation, that is widening of blood vessels, third we have the increased vascular permeability, that is the leakiness, fourth the stasis, that is the slowing of blood flow, and fifth point is leukocyte margination and adhesion. So a very easy flow chart of vascular events of acute inflammation, if I draw it out here, it can be starting with injury. We had immediate vasoconstriction in seconds. Okay, then we had vasodilatation of arterioles, which had increased blood flow resulting in redness and heat. Then we had increased vascular permeability, wherein the fluid, blood plus proteins leaks out, resulting in swelling. Then there is exudation of plasma proteins. The fibrin and antibodies enters the tissue. Then there is stasis, wherein the RBC concentration increases, followed by leukocyte margination and adhesion. Wherein the WBCs stick to the vessel wall. And lastly, we have the leukocyte immigration, also known as diapedesis, wherein the WBCs move out to the site of injury. Now what is important for us to know is the triple response. So what is the triple response? The features of hemodynamic changes we studied just now are best demonstrated in the Lewis experiment. So what did Lewis do? Lewis did a classic experiment on acute inflammation in a human skin, the forearm of the human being, by scratching the skin lightly with a blunt object, and it showed the triple response of Lewis. So the very first step, the red line appears in seconds. When the skin is stroked, the capillary dilatation is there at that spot, which is mediated by histamine. So after red line, there is a flare. The red area around the line is known as the flare. The surrounding skin also becomes red due to arteriolar dilatation from an axon reflex, which is nerve mediated. And then we have the wheal or the swelling, which is a raised bump appearing at the site, which is caused by increased vascular permeability, wherein the fluid leaks out. If we see the definition of flare, so flare is the bright reddish appearance or flush surrounding the red line, and it results from vasodilatation of the adjacent arterioles. And the wheal is the swelling or edema of the surrounding skin. This occurs due to transudation of fluid into the extravascular space. So after vascular events, we have the cellular events. So the cellular phase of acute inflammation includes recruitment of leukocytes at the site of infection, their activation to recognize the microbe, and eventually phagocytose and clear off the offending agent or the causative agent. So we'll learn about each step of cellular events in a super easy version. The very first step in cellular event is exudation of leukocytes. So in exudation of leukocytes, सबसे पहले is changes in the flow of blood. Changes in the flow of blood, which can be also called as margination, wherein the WBCs, mainly neutrophils, they move towards the periphery of blood vessels. And why they move? Because the blood flow is slow. Okay. Now the next step is rolling and adhesion. Rolling and adhesion. WBCs roll along the vessel wall and firmly stick to the endothelium. Now the process of rolling is facilitated by following CAM, that is the cell adhesion molecules, or ARs, that is the adhesion receptors. Now CAMs are expressed in response to cytokines. That can be TNF, IL-1 or chemokines, that's produced after exposure to microbial infection and cell damage. So after rolling and adhesion, there is transmigration, which is also known as diapedesis, wherein the WBCs squeeze between endothelial cells and leave the vessels. So what happens is, after leukocyte endothelium adhesion, which we saw in the previous step, the neutrophils move along the endothelial surface till a suitable site between the endothelial cells is found. And once the suitable site is found, the neutrophils throw out cytoplasmic pseudopods. Okay. Now next we have chemotaxis. What is chemotaxis? It is the movement of leukocytes towards the direction of chemical molecules or factors which are called as chemoattractants. So chemotaxis is the movement of leukocytes towards the direction of chemical molecules or factors called chemoattractants. So now the chemoattractants for leukocyte may be of two types. The first is the exogenous agents. The most important exogenous agents are soluble bacterial products such as formylated peptides.